National Health Project is an effort to provide better access to water. We are focusing in areas like La Calera, Paso Hondo, and Cerro Grande, which are rural communities in Nicaragua. Over 1 million people are currently living without clean water in Nicaragua. This is almost 1 in every 5 people. Um, from wateraid.org, we find some information about how is the situation in Nicaragua, how bad it is. So this country have a long rainy season and large lakes make for ample freshwater sources, but much of the water is inaccessible and unsafe to drink. To make matters worse, natural disaster and conflict, political conflict, has devastated public service and reduced investment. So this community, what it needs is resources, and those resources are meant to help them dig wells that it can provide water to supply for their needs. Here we have a woman from La Calera. She's trying to make a stream and get some water. This water, they would use it to take showers or to wash their clothes and to give water to their animals. You can see is a woman digging the dirt from the river because the men are working, trying to find money to bring home, while women are trying to survive and get all the water they need to have clean clothing and to protect their kids. But as you can see, this water can easily be contaminated, and that contamination gets through the water and the clothing. Here we have some pictures. As you can see, those are the kids, not all the kids from the community, but a lot of kids coming with their mothers to see them wash their clothes while they're playing with the dirt and water by their side. And this is what's going to happen. This is the next generation, and they're gonna keep doing the same thing as the mothers are doing. The boys will go to work, and women will try to find solutions for doing the things around the house and clean their clothing. And you can see the water is already white because the soap from the washing clothing are getting into the water, and from that they can get disease like bacterial diarrhea, which most of the kids will get it easily. They are the most susceptible to get it, or hepatitis A, which affect the liver when they consume water that is infected, and the symptoms can last from 6 to 9 months. So can you imagine this happening to this woman trying to survive, or the men's trying to work and bring income to their houses? We can have a diagram of the things happening when they don't have good access to clean water, whether they can consume and give to their animals and used for agriculture. Those are rural community, and the main economy are based on the things they can grow. Here we have more images of the women. Here they were washing their clothes. You can see she's getting ready to get a shower, and they carry their clothes already washed in this compartment, and they bring it to their houses to let it dry and continue with their day. Here is a house and a toilet from the community. You can see the conditions they have is not the best, and the area is very dry. During the winter, this area will get really wet, so they can get some other diseases from mosquitoes like malaria and dengue. This is a disease that can spread very high in this area.
Getting in Honduras might be a challenge. The U.S. Department of State recommends travelers take extreme caution and care when visiting. The country has a problem with drug trafficking, rape, and violent street crimes. Right now, it is a level 3 travel advisory. It also might be difficult to convince the government that we are there with good intentions to help the people and not turn them against their government. We want to make it possible for the locals to have the knowledge of fixing the equipment and maintaining the wells that are put in. We take for granted every day the convenience of having water to drink, bathe, and for recreational uses. So we not only want to put wells, but we want to have some sort of a water filtering system that they can filter the water themselves. We want to have enough funds to not only supply the wells, but to have money available for them to maintain the equipment, test the water, and have access to an engineer.
Our intervention will solve the problem of supplying the communities with clean, safe water because we have people both within and without the Nicaraguan villages who have a knowledge of the area and the location for the long-term clean water. We will be acquiring a Rulion Model F200 portable water drilling rig to easily reach the known depth of 300 feet to the clean water aquifer previously identified. Our team will solve the lack of long-term clean water by spending approximately 2 days drilling to the aquifer using carbon steel well casing, and at the same time building the cistern and pump supply that will supply all the villages.
The very first step we would take in actually implementing our intervention is to focus on what Jeanette pointed out about gaining access to the country. But we would preferably go through our local government to reach our state government and federal government to get us in contact with the U.S. Embassy, unless we could get directly into contact with the U.S. Embassy and Ambassador Kevin K. Sullivan, who's U.S. Ambassador to Nicaragua, just to notify him of our plan and ask for help to make sure we maintain safety, as well as any knowledge that he can give us in regards to this project. The next step would be funding. We would meet with local organizations, community leaders, and companies to explain our plans, our goals, and seek funding for them. As far as the wells and the filters, we will plan to do research to find the most qualified and reliable professionals to help assist in this, especially since there's been a lot of work done with wells there and filters already, but in these specific villages, they're not functioning properly, or they're not completed. And most importantly, something that Jeanette touched on was the education, instruction, and training for the locals there. We not only want to try and meet with professionals who can help us understand about wells and filters to the extent that we need, but we want them to be able to help us understand a way that we can explain how things will work to the locals there, why it'll work, as well as how to maintain the equipment that we provide them. And that is our plan for as of right now.